that, we have the patient all set up. We got airway, breathing, and set up. Now, what are we going to do with all these? We have all these medications to give. We have some fluids to give. We got to do blood. We got to get a chest x-ray and a 12 lead. It just seems so overwhelming. What are we going to do first? So what we can do, though, is we can delegate. In the meantime, is this patient still in street clothes? All right, let's delegate to the UAP, to the CNA to get the patient in a gown. We can delegate and ask other nurse to help us out to get the EKG, the IV, and the blood work, because you need to get to the Pyxis, right? You need to get these IV fluids. You need to get the steroids. You also need to call respiratory therapy and get an x-ray, because you want to let the respiratory therapy know you have a nebulizer going, and give them the status update and an x-ray. So in the meantime, the other nurse went ahead and got the 12-lead EKG, which was normal. They started the IV, but before they got the IV fluids going, remember, they got the blood work. Blood work is so important to get before, especially your blood culture, before you start the antibiotics, because otherwise it's not going to be accurate, or you might not capture the specific bacteria. So you start the fluids, you're going to confirm blood cultures and sputum culture before IV antibiotics. Sorry for the messy writing, but I can't express this enough, and you will see this most likely maybe on exams or on NCLEX. Throughout the process, check the O2 sats. Does it have a good waveform? Vital signs. Is the head of the bed up? These are the little things that you're going to see. Is the head of the bed up? Make sure that they're not slouched over. Now you wait for blood to come back. Now you're waiting for the x-ray to come back. Is the patient stable? Then go and chart. So what is your diagnosis of this patient?